One of the most difficult questions to answer in this environment at the moment is around whether or not the biomarker, the PD-L1 biomarker, is useful. Just giving a little bit of background about the biomarker, we're looking at protein expression of the biomarker. We have 5 different drugs, and the 5 different drugs all have a unique diagnostic biomarker looking at different expression of PD-L1, either on tumour cells, immune cells, or both, different cut points and different antibodies. So there are potentially an infinite number of biomarkers or methodologies that we can pick. When you look at the results of the biomarkers in conjunction with the efficacy of the drugs, you can usually show some enrichment. So the underlying response rate is somewhere between 15 and 20% in unselected patients in platinum refractory disease, and you can bump that up by about 10% using the biomarker. Just recently we've shown some very contradictory results though, in the biomarkers are performing in a consistently inconsistent manner. And what that means is we have some trials which show they are good prognosis, other trials that show they are of poor prognosis. We have some studies which look like they may be predictive, other studies which show they're definitely not predictive. And then we've got a final group of studies that actually show the same drug using the same biomarker is behaving differently in platinum refractory disease compared to the first line setting. So every time we look at the biomarker, we're getting complicated results. And that suggests to me that actually this may be a flawed technology. And it may be that we have to move to a second generation of biomarkers, and that's something that I've spent a lot of time working on. And we're looking at gene expression, key genes associated with T effector type signatures, but also tumor mutational burden. And tumor mutational burden looks like it may actually be predictive and not prognostic. And that might be a step in the next direction. And then the final piece of this jigsaw is we may be able to combine these different biomarkers to increase the accuracy about selecting patients.